Hello guys. Hello guys, welcome back. We'll start the quiz at as usual 10:10. So we'll wait for 4 more minutes and we'll start the quiz soon. Hello guys. Wait for 4 more minutes. So those who are watching us on YouTube live stream, you can also join the quiz by scanning the QR code or directly typing the ahaslides.com/9KOAJ, all in caps. Okay, 2 more minutes, we'll start the quiz. Guys, in case you are watching the quiz in YouTube stream itself, you can also answer the questions in the comment section. So we'll start the quiz with 10:10. Uh, Welcome to Juxtamed quiz. So today, on 25th, the quiz is on cardiovascular and venous topic. So it's the first one. Yeah. A 45-year-old male presents with stab injury to the left side of the chest and trapped in the space in the midclavicular line. So, which structure is most likely injured? I think this is the easy one to start. Easily, you can tell the location based on the location. So to give a clue, the structure is a major organ located near the ribs, and it is not covered by the lungs anteriorly to some extent. So let's see the leaderboard. Okay, we have Chiru leading, followed by SS, then Ashish, Takvi, and Apu. Okay, let's move on to the next one. Okay, a patient presents with chest pain, hypotension, and muffled heart sounds following a blunt chest trauma. So, what is the most likely diagnosis? Guys, can you tell what is this triad known as? Yeah, we often get questions on these triads clinically. Let's see. Yeah, it's cardiac tamponade. Yeah, this occurs in after a traumatic event to the chest. The hallmark are muffled heart sounds, hypotension, and bradycardia. Yeah. Let's see the leaderboard. Okay, we have Ashish in the first place, followed by Divya, then Apu, Chiru, AG, then we have Dr. Riz, then Krishna, Hemant, S, CK, and RD, and Mahesh. Good going, guys. We'll move on to the third one. Yeah, which of the following is the most appropriate initial management of a tension pneumothorax? So, in tension pneumothorax, air accumulates in the pleural space and cannot escape out. So, the pressure continues to build, which leads to mediastinal shift and a compromised venous return. So, the initial step would be it's needle decompression. Okay, we have Dr. Divya now in the first place, followed by Dr. Riz, RDT, Mohan, Mahesh, Myra, Ashish, Krishna, and Komal, and Apu. So let's move on to the next one. A 52-year-old man presents with venous ulcer over the medial malleolus. Duplex ultrasound shows reflex in the great saphenous vein. What is the best initial treatment? This condition is often a result of venous insufficiency. And can you guys tell what is the medial malleolus area called as? There's a specific name for it. So here they are asking the initial treatment. It's compression therapy. Initially, the question is asking you what is the initial step, not the treatment of choice. It, it's the first step what you do in a treatment. If compression fails, then you obviously do the other treatment. Let's see the leaderboard. Okay, we have Ashish leading now. Then in the second place, we have RDT. Then third place, we have Divya, followed by Krishna and Naga. Okay, here comes your fifth one. A 50-year-old patient with morbid obesity underwent a bariatric surgery. Post-operatively, he developed anastomotic leakage at the gastrojejunal anastomosis, which surgical procedure is most likely responsible for this complication. Okay, let's see the answers now. Yeah, it's raw NY gastric bypass surgery. So these type of question can also be asked indirectly. This actually tests your this one gastric surgery as well. Okay, we have RDT in the first place. Second place we have Ashish. Then at the third place we have Krishna. Then followed by Divya. Then Myra, CK, Komal, Age, Dr. S, Mohan, Mahesh, S, Reddy. Good going, guys. We have three more questions, four more questions. Okay. A 45-year-old male undergoes laparoscopic inguinal hernia surgery. During trocar placement, he suddenly develops a brisk bleeding from the preperitoneal space. So the surgeon controls the bleeding with electrocautery and identifies the vessel involved. Which of the following vessels is most likely injured here? To give a clue, the vessel is an important part of blood supply to the lower abdomen. It's situated in a location that's prone to injury during lap hernia surgery. Yeah, correct. It's inferior epigastric artery. So we have RDT, then Ashish, Krishna in the first top three places, top three place. And we have Myra, Aisha, Divya, Komal, Advik, Naga, and AG. Okay, let's move on to the next one. A 30-year-old male presents with a swelling in the groin that increases in size with coughing. On examination, a mass is palpated in the inguinal canal. Which of the following structure is most likely to be found in the inguinal canal in this patient? Basically, they are asking you the contents of inguinal canal. Instead of giving a straight question, they can also give the type of clinical question. Nothing but they have asked the contents, that's all. I think you guys will get this one. Yeah, it's ilioinguinal. No. Can you also type what are the other structures present in inguinal canal for those who are watching us on YouTube live? Okay, we have Ashish now in the first place, then Krishna, followed by RDT, Myra, and Aisha. Okay, three more questions to go. So here's your eighth one. Okay, a 50-year-old diabetic presents with a non-healing ulcer on the left of his left foot. On examination, he has diminished pedal pulses and an ABI of zero point 0.6. What is the most appropriate next step in the management? I think this is how NEET PG asked the question, I guess. So I have tried to make it as similar questions. Yeah, it's referral for angiography. Good guys, you got it. Okay, we have Ashish now in the first place, and we have Myra in the second place, and we have Dr. Divya in the third place, followed by Aisha, then Krishna, Mahesh, Advik, CK, Aditi, Naga, and Komal. Okay, and Ashish has the longest streak. Okay, good going, guys. So let's move on to the ninth one. A 60-year-old male smoker presents with claudication, erectile dysfunction, and bilateral buttock pain, which worsens while walking. His ABI is significantly reduced. Which of the following is most likely diagnosis? I think these three forms are triad of some syndrome, very important syndrome that of we can get a question on. So low ABI suggests a poor circulation in the lower extremities. So let's see. Yeah, it's Lerish syndrome because there are three classical symptoms here. That is, one is claudication due to peripheral arterial disease. Then we have erectile dysfunction and bilateral buttock pain, which is caused due to blockage at what level is? Can you type in the comments? At what level is the block found? Okay, let's see the leaderboard now. Okay, we have Myra in the first place now, then followed by Ashish, Krishna, then Advik, RDT, Divya, Aisha, S, Mahesh, and Soumya. Okay, so the last question of the quiz. Yeah, 55-year-old male with a history of cirrhosis and ascites presents with increasing shortness of breath and a right-sided pleural effusion. So the pleural fluid analysis is a SpAAG ratio of 3.2 and the fluid is low in protein. So what is the most likely diagnosis? So the elevated albumin gradient and low protein in the pleural fluid suggest a pleural effusion, which may be caused by liver disease. So this is commonly seen in cirrhosis and ascites. Yeah. The answer is hydrothorax due to cirrhosis. Exactly. Okay. Let's see the leaderboard. Okay, we have Ashish back. Okay. Congrats, Ashish. You are the winner of the quiz today. So congrats to RDT, Myra as well for bagging the second and third place. And yeah, today that's all for today's quiz. So thanks, thanks to you all to joining this quiz. So please tell us in the comment section how was the question? Are they very easy or moderate or any suggestion from your side? So I hope you enjoyed the quiz and you revise some topics and stay tuned, stay sharp, don't stop. Okay, guys, thank you for joining and see you in the next quiz.